Hello and welcome to the virtual health fair. My name is Laura Bowles. I am the marketing and communication specialist for Dixie Regional Medical Center. Today I'm excited to introduce you to our presenter. Her name is Sunny Thomas. She has been a nurse for 12 years and 8 years as a international board certified lactation consultant. And she has 4 kids. And today she's going to be presenting on breastfeeding essentials and what every learning mother should know. So today we ask that any viewers, if you have any questions throughout the presentation, please ask your questions in the chat. And if you would prefer to ask your questions privately, feel free to email communityfeedback@imel.org. Thank you so much for joining us, Sunny.
Hi everyone, I'm excited to be here with you, getting off to a good start with breastfeeding. I'm just going to kind of go over some basics with breastfeeding, some latching and positioning, and how to be successful with breastfeeding and getting off to a good start. So just by being here and listening and gaining some knowledge, even just a small amount of knowledge on breastfeeding prior to even doing breastfeeding is going to help you be way more successful. So I'm excited to be here and hopefully give you some great tips and information. So here at Dixie Regional Medical Center, we have IBCLCs, which means we have a special certification as International Board Certified Lactation Consultants so that we can give you the best evidence-based knowledge in breastfeeding. There are 2 of us on the mother-baby floor 5 days a week. And then we also have a IBCLC in our newborn ICU so that you have all the support that you need when you come to the hospital here at Dixie Regional. We also have an outpatient clinic where moms can come in anytime, 5 days a week, and get support and help once they've been discharged from the hospital. So we love that when we see moms that come in, and babies can be anywhere from 2 days old to a year old. So we love to give that support. So some of the benefits of breastfeeding for baby. So there are many benefits. There's over 200 different types of fatty acids in breast milk. They're finding out new ingredients in breast milk all the time. We're always finding out new things. So for baby, it's easily digested. It's perfectly matched nutrition for the baby. It provides the baby those antibodies and protection to protect against infection. Decreases the risk of allergies and also reduces the risk of SIDS. So breast milk is the best thing that babies can get that first 6 months of life. And then at that 6-month mark, the Academy of Pediatrics recommends that is the time where you can start to introduce some foods along with breastfeeding. Some babies love to take in the foods and some babies are not really interested, and that's okay. The main nutrition is breast milk up to a year old. With that supplementing foods at 6 months if the babies are interested in that. Okay, so what are some benefits to mom? And the main thing is it's very convenient, right? You don't have to have any bottles. You don't have to carry around a whole bunch of stuff, no washing. You can just put the baby to the breast when the baby's hungry. So that's very convenient. It's very economical. It saves $500 to $1,000 or more a year just by breastfeeding and not having to buy the formula. It also helps the uterus contract and go back to normal size quicker. So mothers that breastfeed tend to have their tummies flatten out a little bit faster. It also reduces the risk of breast and uterine and ovarian cancers and is also shown to decrease the risk of type 2 diabetes and improve bone density and reduces the risk of osteoporosis. So it's a great benefit for moms and babies to help them be as healthy as possible. Okay, so this picture shows a little anatomy of the breast. And as you can see there, you can see those little grape-like clusters in the breast, and that is what I call the factory. Those are the alveoli. So that is where the breast milk is being made. Okay, and then you have the ductules that go down and then down to the tip of the areola and the nipple where the main milk ducts are. So that glandular tissue around that alveoli and then that alveoli, which is that factory, right, is where the milk is being produced. So every time either the baby feeds at the breast and takes the milk out of the breast, or you pump and take milk out, that tells your factory to make more milk. Okay, so that alveoli starts producing more milk, the more milk that is expelled. Most women will start producing colostrum around 16 weeks of pregnancy. So at 16 weeks, your body is always already prepping and getting ready to breastfeed. And normally mothers will find when they find out they're pregnant, one of the first signs of pregnancy is that the breasts begin to get very tender and the breasts seem to grow. And a lot of times the areola will get larger and darker. And that is because the breasts are preparing to breastfeed. It's becoming a target for the baby so that when the baby is born, that areola is larger, it's darker, the baby can see it, and it is preparing the body to breastfeed. And then we have the alveoli, which is the round area around the nipple. And then we see these little, on this picture, you can see the little bumps on the areola. Those are called the Montgomery glands. And you may have noticed those when you find out you're pregnant. You don't notice them before then, but when you're pregnant, you start to notice those little bumps around the areola. And they release a scent that draws the baby to the breast. Okay, so the baby will smell that when they're put skin to skin on mother's chest, and it will draw the baby to the breast. And it also has that antibacterial and lubricant to kind of protect the areola and the nipple. So, and the way it kind of works, when the baby suckles at the breast, the baby saliva tells your body what to make for your baby. So once the baby's to the breast, if the baby's come in contact with any viruses or bacteria, your body, when the baby breastfeeds, is already preparing and making perfect milk for your baby and what your baby needs. Okay, so the two main hormones that are involved with making milk is prolactin and oxytocin. So when you're pregnant, your progesterone and estrogen is really high. And then once you deliver the baby in the placenta, the estrogen and progesterone drops, which causes that prolactin to rise. Okay, and that triggers your body. Okay, it's time to make that milk. So prolactin is that milk-making hormone. It tends to be higher in the night, so that's why babies love to breastfeed at night, because that prolactin is higher. There's more milk available in the nighttime and first thing in the morning. And then as the day goes on, prolactin levels will tend to dip down. So there may not feel like there's as much milk by the end of the day, but the emptier the breast is, the more fat is in the milk. So it's just the way it's made. It's perfectly made to get the baby what they need, so the baby gets that extra fat at night to help them sleep. Okay, then oxytocin is the other hormone involved in breastfeeding. Oxytocin is makes the milk let down. It's the milk let down reflex. We also call it the mothering hormone, the bonding hormone. It's the feel good hormone, okay? It helps you bond with your baby. Usually mothers will say, when I let down milk, I feel kind of tired, I feel a little relaxed. It helps you just kind of relax and bond with your baby. When the baby suckles at the breast, it sends a signal to your brain to tell you to let down milk, and then that oxytocin lets down and the milk lets down, which also causes your uterus to contract. So that's what's causing your uterus to contract and flatten out your tummy a little bit faster. Okay, so what causes a milk ejection reflex? You know, not all women feel a milk ejection reflex. Some people feel it, some people don't. And that doesn't mean the milk is not letting down. The milk is letting down. It's just that some people feel it more than others. And a lot of times, sometimes first-time moms may not notice it as much as when they have other babies, because you become more sensitive to that and you notice it more. And there's multiple milk letdowns during a feed. Usually the first one is the one that you feel the most, but there are multiple milk letdowns. And usually if you can't feel it, you're gonna know, because all of a sudden the baby starts gulping and drinking. So that's letting you know that the milk is letting down. So normally it's a tightening of the breast, a tingling, a warm sensation. You'll feel, usually it happens when it's time to feed the baby and you almost feel the milk, the breast filling up with milk, okay? It normally doesn't hurt. Sometimes the breast will feel a little tight, but that's just the milk letting down, preparing to breastfeed. Okay, so what can cause that? It's time to feed. You hear a baby cry. Usually you're in a store and you hear the baby cry and you're like, oh no, here milk's coming. So sometimes it's even smelling a baby, thinking about the baby, gently massaging the breasts can cause that milk to let down. So that's a great tip too. Doing a little bit of breast massage before putting the baby to the breast or pumping can help prep the breasts to be able to let down that milk a little bit quicker. Okay, so colostrum. Colostrum is what we call the liquid gold, and that is the milk that you're producing when you're pregnant and the milk that you produce for the first 3 to 4 days of life of the baby. Okay, it's the first milk. It's very, very high in protein and is easily digested. And you can see in this picture, it's a thick yellow. It doesn't mean all mother's milk and colostrum is going to look that way. Some colostrum is clear, some is more white, some is this yellow color. And it doesn't really matter. All moms produce some colostrum. It can just look a little bit different than that, okay? And the baby only gets that for 3 to 4 days and then never ever gets it again. So it's very small. Usually at a feed, the baby will get about a teaspoon. So if you can see in my, let me see if I can put it on here. You can see in my picture here, this is a little teaspoon and that's filled up with some colostrum, okay? So at a feed, the baby gets about 5 to 7 ml per feed in the first day of life, okay? It's tiny, 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 tiny amount. But the baby's tummy on day 1 is about the size of a marble, if you can see that. Just the size of a marble, tiny, tiny. So the baby only needs a teaspoon per feed in that first 24 hours. So colostrum, what are some benefits of colostrum? So colostrum has a laxative effect. So when the baby's born, they have that black meconium poops, right? That are hard to get off. So that colostrum goes in, coats the baby's intestines, and then when the baby does need to go to the bathroom, it will help have a laxative effect, okay? It's beneficial at loosening the mucus. We call it the first immunization that the baby ever gets, okay? And it's going to provide antibodies and passive immunities to the baby. It coats the stomach, intestines, and protects against any invading organisms. So it's priming the gut. The gut, when the baby's born, is sterile, and that goes in and protects that tummy, okay? Okay, so how much can my baby hold? And I kind of showed you it with that little marble, and you can see this picture, the little marble there. That's how much the baby's tummy can hold in the first day, 1 teaspoon, okay? Their tummies tend to not stretch, so usually if a baby is overfed, they will just spit it up, okay? So that colostrum is the perfect amount for that little tiny little tummy. And then around 7 to 10 days of age, the tummy increases very quickly. So by 7 to 10 days, it's a good large egg, and the baby's taking in 1.5 to 2 ounces at that 1 to 2 weeks of age. Okay, so it grows quickly. And normally what we find with breast milk is after about a month of age, the babies usually takes between 3 and 4 ounces at every feed the entire breastfeeding journey, okay? So like we talked before, the mother is making perfect milk for her baby. So a baby that's born preterm, baby that's 1 month old, a baby that's 6 months old, or 1-year-old or 2-year-old, the milk is always going to be different. You're making perfect milk for your baby. So usually with formula, as a baby ages, we have to increase those ounces as a baby gets up to 1 year old. With breast milk, they're taking in about the same amount, 3 to 4 ounces at every feed, but the composition is changing to meet the needs of the baby. So if the baby's needing more fat, your body will produce more fat for the baby in your breast milk. Okay, so helpful suggestions in preparing to breastfeed. One of the biggest suggestions I can give you, take a prenatal breastfeeding class. You can come in, we do prenatal breastfeeding classes every 6 weeks where we talk about this stuff, but we also expand on that. And that is going to help you be 4 times more likely to be successful. Okay. Another great thing I suggest is get your team around you. Get a lactation consultant that you can call and ask questions. Find you an OB, a pediatrician that supports you in breastfeeding, and your family. and let them know what you want, what your goals are, and how they can support you. Because the first 6 weeks are hard. They're hard. I'm not going to lie, they're hard. And if you can have your support team around you to support you and help you make it through that first little bit, with the hormones changing and no sleep and all that, you're more likely to be successful, and it will be worth it in the end as you start to really enjoy it and bond with your baby and start to see that things are going better and well, okay? So one of the things you want to avoid is any harsh soaps or scented soaps on the breasts. You can wash the breasts once a day with a, when you're in the shower, with a non-scented gentle soap body wash. You just don't want to have anything harsh on there, okay? You want to get you some breast pads. So as you can see, this is one of my little breast pads. This one is reusable. You can throw it in the wash, but they also have disposable ones. These are awesome because you're going to find in the first 6 weeks that you leak a lot of milk. Okay, so right, that oxytocin release, you start leaking, you're in target, you're like, oh no. So having those breast pads in is going to help prevent any leakage around on your shirt, okay? So breast pads are awesome. You won't have to use them the entire time, but they're nice to have in the beginning. A good supportive bra is awesome. Something that doesn't have an underwire that you can just have on that can hold those breast pads, but it's very comfortable and easy to breastfeed with. I recommend a night bra if you can get one that you can put those breast pads in. That's so comfortable. You don't want anything uncomfortable, that can just hold those in and give you a little bit of support when that milk first comes in. So, and it used to be the thing where you need to toughen the nipples. You'd hear people say that. That's actually a myth. We don't toughen our nipples up, right? It's not, your nipples are going to be tender the first few weeks, and that's okay, and that's normal. But toughening them up with a washcloth prior to having your baby is not going to help. It's actually going to make it more painful, okay? And then excessive stimulation to the nipple. You don't want to be in pregnancy pumping 8 times a day, right? There are moms that breastfeed their first baby and are pregnant with their second baby, and they don't go into preterm labor. So that is totally fine. It's just mainly we have to be concerned with women that have a risk of preterm labor, that they're not doing extra stimulation to the nipple, okay? And then you can use lanolin cream on your nipples at any time, during pregnancy, afterwards, just to help keep them from being too dry. Okay, so types of nipples. You can see in this picture, we have everted nipples, we have more flatter nipples, and then we have inverted nipples. We can breastfeed with all shapes and sizes of nipples. Nipples come different, right? One nipple could be everted, the other one could be flatter. That's okay. We can still breastfeed with all the different shapes and sizes of nipples. Okay, so don't think that if you have flat or inverted nipples that you can't breastfeed. You can breastfeed. Okay, then the main thing is how compressible and movable those nipples are to help get that baby latched on and get a good deep latch. And that's when having a good support is the way to go, because with lactation, we can come in and help and teach you some tips and tricks to get that baby latched on, okay? Okay, so we kind of went over this supply and demand. Once breastfeeding is well established, especially once that milk first comes in, it's supply and demand, okay? So you are the supplier as a mother, and the baby is the demander. The more the baby demands, the more milk you make, okay? So if we're skipping feeds, if we're only doing 4 to 5 feeds in a 24-hour period, you're going to find that your milk supply suffers. So we want to be doing 8 to 12 feeds in 24 hours. Okay, that's what the recommendation, 8 to 12, and then feeding on cue. Okay, so we want to watch those babies' hunger cues, and when the baby shows those, we put baby to the breast. So we're going to do the cue-based feeding, baby-led feeding, on-demand feeding. So here in the hospital, we teach unlimited access to the breast, letting baby be on the chest, doing skin-to-skin with mom, baby down to the diaper on mother's bare chest, and letting baby lead and feeding on cue. And that is going to make sure the baby gets enough milk and also make sure that you have a good milk supply. Okay. We don't want to set fixed times or feeding schedules. Newborns, They don't feed on a schedule. They really don't. They just kind of feed when they're hungry. And they tend to be sleepy, so sometimes we have to encourage them to want to eat. But usually what we find is babies tend to do those 8 to 12 feeds in 24 hours, but they may do 3 feeds really, really close together, okay? They may do three feeds, 3 to 4 feeds, 30 minutes apart, take a 4-hour nap, and then do some feeds closer together. That's okay. That's okay. That's normal as long as we're getting those 8 to 12 feeds in 24 hours and watching those cues of the baby and when they want to eat. Okay, so the golden hour. We call the golden hour that first hour after delivery. Okay, it's a magical time. The babies come out so alert and so awake, and they're ready to eat and suck. It's beautiful. So if everything's good with the baby, there's no complications, no breathing issues, we will immediately put the baby on your chest for skin to skin. Okay, and this mother you can see in this picture, she is doing skin to skin. That baby is put tummy to tummy on her, and the breast is put there at the breast. The baby can smell the colostrum, and the baby is going to be drawn to that breast. So that amniotic fluid and that vernix that is on the baby has a similar scent to colostrum. So it's all made to come together and promote the breastfeeding of the baby. We recommend that the baby not be bathed until the baby has had at least 2 good breastfeeds. Usually babies are not bathed until close to 18 hours to 24 hours because we want the baby to have that breastfeeding initiated before we give that baby a bath. And you don't have to bathe the baby in the hospital. You can take the baby home and not have to do that if that's your choice, okay? So our goal is for you to feed that baby within the first hour. Sometimes, most of the time it happens. If it doesn't, that's okay. Doesn't mean baby's not going to breastfeed. Sometimes it can take 2 hours, and sometimes it takes until they get up to the mother-baby floor and we work with the baby, okay? Totally okay. The babies will breastfeed. Some just take a little bit longer, but most will go right to the breast very quickly because they're so alert right after delivery. Okay, so that first skin to skin with the mom with that bare chest for a good 30 to 50 minutes until the baby starts showing those signs of hunger. Usually what we find is when we put them on the chest like this, they'll start eating their hands, they start bobbing their heads, they start rooting, looking around for the breast when they're ready to feed. Okay, so some of the benefits of skin to skin. Awesome for improved bonding. Okay, just by this mama doing that skin to skin, she's releasing oxytocin, which is going to increase her milk supply, which is going to reduce the stress in both her and her baby, and it's going to actually increase blood sugars in baby just by doing that skin to skin. So that's beautiful. That's what we are wanting to have happen. And it's going to build her confidence in wanting to breastfeed, in learning her baby's cues. And that's why we promote here at the hospital that the babies room in with the moms 24 hours a day so that you can learn those cues and be alert when that baby's showing those cues to want to eat. So some benefits of skin to skin. We have all the vital signs will be stabilized, okay? The temperature, heart rate, respiratory rate, increased state of organization, less likely of low blood sugars, less crying, and increased rates of breastfeeding just by doing that skin to skin. Okay, so what to expect when you come here to our hospital? We do that 24-hour rooming in. We do all bathing, all procedures, everything in the room with mama, okay? If for some reason the baby needed to go to the nursery for a procedure or anything like that, you never have to leave your baby, okay? You or father of the baby, significant other can go to the nursery with the baby. But if everything's good, babies never leave the room, okay? So that's where you're going to see those hunger cues. You're going to get to know your baby. New research shows that if mothers room in with their babies, they actually get more sleep. Okay, we think, oh, we'll send the baby to the nursery, get more sleep, but actually research shows that the cortisol level in mom and baby increases when they're not with their baby. So you tend to get sleep less. So rooming in is very important. We do latch scores. So what a latch score is we're looking at how the mother feels about her latching her baby. Is she having any pain when she latches the baby? How does she feel comfortable positioning the baby? Do her nipples hurt at all? Those are some things we're looking for. And so the nurses, once per shift, will want to look and make sure the baby's latching well. Okay, so that shows the pediatricians that the babies are latching and doing well, so that when you go home, you feel confident, that you feel like you know how to latch your baby and feed your baby. Okay, so because we don't want you leaving our hospital without feeling like you can position and latch your baby. So, and just know you can always call for a lactation consultant. We round on every mother. Usually we will see a feed on all first-time moms, all small babies, large babies, and then any mother that requests a feed. We will come in and do hands-on lactation help with moms, okay? So our goal here at our hospital is to exclusively breastfeed your baby. We are going to support any goal that you have. So if you want to do both, or you want to formula feed, you want to exclusively breastfeed, we're going to support your goal and support what you want to do. So if you've chosen before delivery that you want to exclusively breastfeed, we're going to support you in that. So unless medically indicated, we don't give any supplementary feeding. We just encourage the mom to breastfeed, okay? And if for some reason, let's say the baby has a medical condition or lost a lot of weight or really jaundiced or low sugars, we can get a breast pump in the room. We can do hand expression and get baby some more colostrum. We also offer pasteurized human milk here at our hospital. So that is an option too, that you can have that pasteurized human milk that's completely safe and tested to feed to your baby. So there's different ways that we can go about that if that is a medical need. But we love most babies leave our hospital exclusively breastfeeding. Okay, so we're going to go over a few positions. Hopefully you can see me in the little camera here, but I'll be quick with this, and because once you come in and you have the baby here in the hospital, we'll go over this a lot more, and the nurses are awesome and trained to help with all of this. Okay, so we're going to go over cross cradle position. This is my favorite position, okay? The reason I like this position so well is you can see how this mom, her hand is right here on that baby's lower back and neck there. She can control the baby's head and bring the baby on really deeply. Okay, so like I was saying, the first couple of weeks, your nipples are going to tend to be a little tender, right? There shouldn't be cracks, bleedings, blisters, none of that should be going on, but you're going to have a little bit of nipple tenderness. So we want to be very, very preventative. We're going to position and latch this baby as well as we can get, so the baby gets more milk, more colostrum, and prevents you from having any nipple soreness, okay? So I have my little baby here. So what I love about this hold, and you can see that in this picture too that you're looking at, my elbow is right around the baby's bottom, my thumb and middle finger on each baby's ear, and I can hold the breast with my other hand and guide the baby's head onto the breast, okay? So that's an awesome position because you're bringing the baby to you and you're not leaning forward and just trying to get the nipple in baby's mouth. That's going to prevent really sore nipples. The next favorite position is the football hold. And you can see with this mom, she just kind of puts the baby in the football position right at the side. She rolls the baby tummy to tummy. All positions, the baby's rolled tummy to tummy, okay? Her hand is still in the same spot. Thumb and middle finger on each side of the baby's upper back neck area. And what I like to do, got my little fake breast here, is we push back and we hand express and we put a little drop of colostrum on the tip of the nipple. Okay, so hand expressing a drop of your colostrum on the tip of the nipple, the baby can smell it, the baby can taste that. We use the upper lip and rub that on the upper lip of the baby's mouth. The babies will normally open really wide, and then we latch that baby on quickly. Okay, and that's going to prevent you from getting those really sore nipples. We want that mouth really big and wide when we bring the baby on. But in that football hold that she's doing, you can guide the baby onto the breast. Okay, you control the baby's head. And then this is the cradle hold. This is the hold that you're probably going to go to when your nipples are not quite so sore, Or you may not have sore nipples, and this is a comfortable position. This is a position that we feel comfortable feeding babies, you know, we hold babies like this, so it feels comfortable. What I find with this position is when the babies are right here, you don't control the head, right? So you're kind of leaning forward and you're trying to get your nipple in there, and they tend to get right on the tip of the nipple, and then mom's nipples get really, really sore. So if you're not sore, you do any position that works for you. But if you're tending to get a little tender and your nipples are starting to get sore, it's usually that football or that cross cradle position will get you a little better latch. And then this is our side lying position. This is the position you definitely want to learn how to do so you can rest. Usually it's hard to do in our hospital beds, but once you get home, start practicing that hold and that position so that you can get more rest with your baby. Now this is a laid back position. So she's kind of doing a cradle position in a laid back position. Baby's rolled tummy to tummy on her. The reason we love the laid back position is, especially with moms that have really sore nipples, okay? You're working with gravity. You're leaning back and it works with gravity to bring baby deep into the breast, chin deep in the breast, and it really helps with really sore nipples, okay? And it also is really good for babies that may have taken a little longer to latch and breastfeed right after delivery. Something about that laid back position will entice the babies to want to breastfeed, and they do really well with that. This is a great position we can do here in the hospital because our beds kind of lay back a little bit. Okay, so proper positioning and latch are key. If the baby's not properly latched and positioned, the baby will get hardly any milk, okay? So we have to make sure the baby is really latched on there well to transition the milk effectively, okay? So we've got to get that good milk transfer. Correct latch. So what are we looking for when we're latching a baby? Okay, so like I said, we want that mouth as big as possible. Okay, we don't want a little pinched mouth. We want a big, wide mouth. So we want to wait until we tickle the upper lip with the nipple, with a little bit of colostrum, wait for the big mouth, and then bring baby to the breast, okay? We want the little lips rolled out. We call this phalange lips or froggy lips or fish lips, right? We're just rolled out. That's going to prevent the chafing of the nipple there. And then the tongue is going to be on the lower gums. So the key with breastfeeding is the baby uses their tongue to go inside, grab the breast and the tissue, and bring the nipple in. Okay, so if they can't extend their tongues, they're going to tend to bite down on you to kind of stay on, right? So we want that tongue to be out, go as far as possible, and bring that breast in. Okay, so sometimes these little newborns, they take a little while to maybe get latched on because they're moving around, and it takes them a few times. They're learning how to do it, but normally once we can really get them on and latch, they should stay on the breast. Okay, they shouldn't just keep popping off. And then we're going to listen and watch for milk transfer. That's the key, right? If the baby's not transitioning milk, the baby's not getting milk. So we've got to listen. In the first 3 days, when the baby's getting a teaspoon at each feed, you're not going to hear gulping. You're going to just hear tiny little swallows. Sometimes you can hear them, but a lot of times they'll do a suck, 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 and then a drop and pause in the jaw. Suck, 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 drop and pause in the jaw. That's a swallow. Okay, so you can visually see it and you can hear it. Okay, and these newborns in the first few days, they're basically sleepy a little bit, right? They're doing a little suck first and then they pause and they want to rest and breathe and go to sleep. That's why we have them down to the diaper, so we can lightly stimulate them, keep them interested in wanting to feed. Okay, so this is a great picture. You can see in this picture, this nipple here, this mom's nipple, look how far back into the baby's mouth that nipple is. That's how important it is to get a good deep latch. Okay, so this is the baby's soft palate, and up here is the baby's hard palate. If that nipple was up here in the baby's hard palate, that's when the mom's nipples are going to get really sore. So we want that nipple pulled all the way back into that soft palate. It's breastfeeding, not nipple feeding, right? That baby is compressing the breast, compressing those ducts. Lots and lots of milk coming out. So that's the goal of what we want to see happening. Okay, so we're going to kind of just go over this really quickly, what we talked about. We want to be comfortable when you latch the baby. We want the nose aligned with your nipple when you bring the baby on. Great way to know how to position your hand when you're latching your baby is when the baby latched on, your thumbnail is across from the baby's nose. No matter what position you do, to know how to place your hand, either the C hold, the U hold, around the breast, if your thumbnail is across from the baby's nose, you're going to know you have your hand in the right direction, right? Just like we take a giant hamburger and we squish it down so we can get a big bite. That's what we're doing with the breast. We're doing a breast sandwich to get as much tissue in the baby's mouth as possible. Okay, so this mom's got that C hold. Her thumbnail is across from the baby's nose. She's waiting for that big mouth. Look at that. Perfect. This is what's going to give an asymmetrical latch. So what we're going to do is we're going to wait for that big mouth, and that little baby is going to open up nice and big, and we're going to aim that nipple towards the roof of baby's mouth. Okay, and there's more tissue in the bottom of the areola than the top. So you're going to see some at the top. And that's called an asymmetrical latch, where the baby can get lots and lots of milk. Okay, so we don't want him to latch on the tip of the nipple. We want that mouth nice and wide, wait for that rooting reflex, and then bring baby on with the chin leading in an asymmetrical latch. Okay, and then you just bring the baby to the breast, okay? We don't want to push their head on, right? If we have our hand right on their head, they'll tend to want to yank back. So that's why I say we go at the upper back, thumbnail, middle nail on each side of the ear, and kind of act like a second neck to kind of bring that baby on deeply so you can get a good deep latch. Okay, so how do we take the baby off? What if we go, oh my goodness, this is hurting? We use our finger, okay? You go in the corner of the baby's mouth and you break that latch between the jaw there, okay? Because they can do nipple damage if you just yank them off. So this is kind of my rule of thumb. We're going to latch the baby on as best as we can. We're going to wait 30 seconds to a minute to decide, okay, this is a tug-tug tenderness, or is this pinchy and painful? Usually the first 30 seconds, there's a little tender because you're just putting the baby on, you've been breastfeeding a lot, your nipples are not used to it. It may be a little painful that first 30 seconds. After that first 30 seconds, if you're like, okay, this is doable, it's still a little tender, but it's not pinchy and painful. Pinchy and painful, we take baby off. No matter any time during the feed, if it becomes pinchy and painful, we take baby off and we relatch. Okay, very preventative. So to become successful at breastfeeding, we're going to watch our baby. We're not watching the clock. Okay, like I said, the first few days, they'll sleep for 7 or 8 hours, 9 hours, and they'll never wake up. So we will wake them up during those first few days to a week just because they're so sleepy and recovering from being born. But after that, we're going to feed on cue. If they want to feed 12 times in 24 hours, we feed them 12 times in 24 hours, okay? Okay, so feeding cues. You can see this in this image. We have early cues, mid cues, late cues. So anytime rooting, smacking, we're looking for those cues, and when we see them, we bring baby to the breast, okay? So we want to be feeding those 8 to 12 times in 24 hours. That's anywhere from 1 to 3 hours during the day, no more than 4 to 5 hours at night, and cluster feeding is very normal. Cluster feeding is maybe short little mini feeds really, really close together. Babies tend to want to cluster feed at nighttime. They love to cluster feed at nighttime. Like I said, right, the prolactin has kind of gone down. The milk is a little more fatty at nighttime. Sometimes you'll feel like there's nothing in there, and that's okay. They sometimes will feed for an hour, hour and a half. And I think it's kind of like that stimulation throughout the day. They're like overly stimulated, and by the end of the day, they're like, oh, I just want to suck and be on mom's chest. Okay, that's where they feel safe. They can hear your heartbeat. And it's not always about nutrition. It's just feeling comfort and being close to their mama and wanting to suckle at the breast, because that's what makes them feel safe. But that will increase your milk supply. They get that melatonin in the breast milk right before going to sleep. They get that nice fatty milk in them right before they go to sleep at night. Okay, so signs of fullness. How do I know my baby's getting enough, right? The baby usually will latch baby on. We let them go as long as they want on that first breast, right? We burp them and we offer that second breast. If they're falling asleep, like constantly, like we can't keep them awake to feed, we can go back and forth, okay? We can go back and forth to kind of keep them awake. Usually they'll just come off the breast. They fall asleep no matter what you do. You can't wake them up. Sometimes before they feed, their fists are nice and tight, and then as they feed, they start to relax. The key, big, huge one, once the milk comes in, the breasts feel less full, okay? During the colostrum phase, the first 3 to 4 days, you're gonna feel like there's nothing in there. I hear that a lot. I don't think my baby's getting anything. There's nothing in here. There is something in there, right? It's colostrum, but it's just small amounts. But once your milk supply fully comes in around day 3 to 4, you're gonna know when the baby fed well because the breasts are gonna feel softer, okay? Burping over the shoulder, you can put them on your lap. Normally I would have this baby all the way down to the diaper just because the babies want to fall asleep unless they're down to the diaper. So we get them down the diaper. I'll usually put a blanket on their back just so that you can kind of pat that back and get a good burp. Usually once the milk comes in, you can get good burps. Sometimes it's a little harder during that colostrum phase because they're just getting that small amount of colostrum. And that's okay. Just try for a minute or two. And if you get a burp, great. And if you don't, move on. Okay. So the first few days, like I talked about, they're going to be sleepy. We're going to wake them up every 3 to 4 hours, get them interested in wanting to eat. This says in here we can pull out the pump if the baby feeds on one side, but you can do hand expression. You don't need to pull out the pump. Okay. Newborns in the first few days, they tend to be sleepy. So I always say offer both breasts, but usually they'll probably just do one in the first few days, and that's okay, okay? We can hand express on the other breast and get a few little drops of colostrum, and we can use that to entice the baby on the next feed, okay? So we're gonna watch for those hunger cues. We're gonna offer both breasts at every feed, and we're gonna keep baby alert and awake, right? We're gonna try and wake them up, get them interested in wanting to eat. Okay, so how do I know if my baby's getting enough? This is our baby poop here. So when the baby's first born, day 1, right, we have that black meconium poop. And it's black and tarry and lots of it. So, and if you don't catch it quick, it's hard to get off. So we first start out with that black meconium poop, and then as we progress, we kind of go to a dark brown, then a green, and then to that yellow mustardy color is the color we're looking for. And we want that by day 4 or 5. Okay, so if a baby is exclusively breastfeeding and by day 5, we're not getting transition of poop, it's not starting to turn that greeny yellow color, that tells me the baby may not be getting enough stools and enough breast milk, sorry. So we're gonna watch those stools. So for day 1, 1 poop, day 2, 2 poops, day 3, 3 poops, and then from day 3 on, we want 3 to 4 stools a day is what we're looking for. Okay, and then after about a month old, they slow down on those poops, and that's okay. Okay. Wet diapers, we're going to be up until day 6 wet diapers. So day 1, 1 wet, day 2, 2 wets, day 3, 3 wets, up until day 6, and then 6 wet diapers from then on out after day 6. Okay. So these are some great little tools that you can use to keep track of feeds, and there's tons and tons of apps you can get on your phone where you can keep track of wet and dirty diapers, how long they fed, what side they fed on. When you deliver here at the hospital, we'll give you a living and learning booklet that has a little place where you can keep track of those things. So that's a great resource for you to have. Weight gain is the #1 way we know baby's getting enough milk and progressing and doing well. Okay, so keep your pediatrician appointments. Go see your pediatrician. It's very important that we keep track of that weight gain, okay? Healthy tips for breastfeeding moms. You're burning more calories, okay? You are, just by producing that breast milk. The key is you need to be eating enough calories. No weight loss diets, okay? You got to be eating enough calories to maintain a really good milk supply. New research is showing that if a mother in her 3rd trimester, right, is starting to take in some omega fatty acids, especially those omega-3s in her 3rd trimester and into the postpartum period, is going to increase those DHA, which is the great omega-3 for the brain of the baby and the retinal health of the baby, okay? So get those omega-3 fatty acids, and the main way to get it is through your diet, okay? Because you're going to have the perfect combination of fats. ACOG recommends 8 to 12 ounces of fatty fish a day. You can get it through flaxseed, almonds, walnuts, green leafy vegetables, salmon, anchovies. Those are all great ways for healthy, good fatty acid in your diet to increase. You can't increase the fat content, but you can increase the DHA. Okay, so you can do that by getting those really good foods in your diet. Some fatty fish you'd want to stay away from, especially during pregnancy, is fish that's high in mercury. That would be swordfish, shark, some tuna. You'd want to stay away from those that are high in mercury. Okay. You're going to drink till thirst. Drink your 8 glasses of water. Then when you feel thirsty, drink more. As soon as you start breastfeeding or pumping, you're going to notice that oxytocin release, you feel thirsty. So have a big Bubba mug next to your bed. When you feel thirsty, drink. Okay, and then you can exercise. Once you get the go-ahead from your OB, your midwife, you can go ahead and start exercising. You just don't want to do extreme exercising, okay? Support from your partner and family. This is huge, right? You got to have support from your significant other, because it's going to be hard in the first few weeks. You know, your nipples are sore, then your milk comes in, and you feel engorged, and then you're tired. So you need to have good support system, okay? Let your partner know how they can support you. And know that moms interact with babies different than men interact with babies, and that's okay, okay? It's good for those babies' brains to get different ways of interacting with their babies and the different ways that people interact. And then ask for help if you need it. If you're needing help, come into our outpatient facility. We'd love to help you. Okay, so yeah, I have some common questions that I get asked a lot, but I hope you put in your comments any questions that you may have. I'll kind of touch base a little bit on a couple of these. Do I need to use a breast pump right away? I get asked this a lot. So you don't, right? All your health insurance companies should cover a breast pump for you, okay, through your insurance. It's a great tool to have. Let's say you get so engorged and you're so miserable, pull out that breast pump, okay? The key is, unless it's medically indicated to get more milk in baby, if you need to pump, just pump to comfort, okay? We don't want to empty completely every single time, or you're going to be making too much milk, okay? So just having that breast pump there available is awesome to have. And usually we recommend introducing a bottle around 4 weeks or so, 3 to 4 weeks, and that's just one bottle every 3 to 4 days, just to keep baby used to the bottle, because we want the baby to take a bottle. We just don't want the baby taking that bottle too soon, okay? And we get used to it and then not want to breastfeed. So what has changed since my grandma has had a baby, okay? It used to be that they'd stick a pacifier in the baby's mouth the second they're born. We recommend waiting like that with that bottle, 3 to 4 weeks. We want breastfeeding well established, good milk supply, before we start introducing that pacifier. Because when the baby suckles at that breast or at that pacifier, they release a hormone that says, I'm content, I'm full. So we would rather have that sucking need be met at the mother's breast and the baby get more colostrum or breast milk than on that pacifier. So what are some things I can do to increase my milk supply? Feeding those 8 to 12 times in 24 hours, eating enough food, drinking to thirst. You want to stay away from like decongestants, antihistamines. Some birth control can decrease milk supply. Smoking, those can decrease milk supply. You can do some power pumping. If you notice your milk supply is down, power pumping is 10 minutes on, breastfeed or pumping, 10 minutes off, 10 minutes on, 10 minutes off for 1 hour. That's power pumping. Research has shown, and this is a great one, you get a back massage, right? Back massage, all those nerves that are in your back stimulate the nerves in the breast. So that's an awesome way to kind of help bring some circulation into the breast, okay? Breast massage and compression as you feed. As you're feeding your baby, doing some breast massage and compression as the baby feeds is going to get the baby way more milk. Okay, great tip when that milk first comes in. Okay, do we have any questions?
We don't, but I have a question for you. Okay. What's the most common anxiety mothers have when it comes to breastfeeding?
I think the most common anxiety is my baby getting enough milk, right? Because our breasts are not see-through. We really don't know, right, how much they're getting out of feed. So, and you can have larger breasts and smaller breasts. It doesn't mean when you have larger breasts, you're going to produce more milk, or smaller breasts, you're going to produce more milk. Everyone has a different storage capacity. So I've heard one mom say, well, why is it that I have to breastfeed 12 times and my friend only has to breastfeed 6 times and her baby's gaining weight and doing great? I don't understand. Because our storage capacity inside our breasts, we're all different. We're all made different, right? So that's why we follow the lead of the baby, and we really watch those cues of the baby and follow the lead, and that will help. I think once you can let go of looking at the clock and being on a schedule and just really watch your baby, it helps your anxiety go down, okay? Because we can't predict what they're going to do. But if we can just like follow the lead of the baby and kind of trust in yourself and trust your baby and follow those leads. And that's why we go to the pediatrician, right? And we get those little checkups and we make sure baby's gaining weight. Because what if you go to your 2-week check and the baby's not gaining weight, right? Well, we can do things at that point. We can start increasing some pumping in there. We can start doing things, come see me and in an outpatient setting. We can do some things to help with breastfeeding. Okay. Awesome.
Okay, well, thank you so much. It looks like you've provided your contact information. So if you do have any questions about breastfeeding for Sunny, her email is right there, sunny.thomas@imel.org. If you have any questions about the health fair, feel free to email communityfeedback@imel.org. Thank you so much for joining us, Sunny. And tomorrow, our first presentation at 10 a.m. will be Overcoming Fitness Barriers with Tiffany Gus.